love playing tennis and golf on the weekends, but pain is holding you back. Well, Dr. Abraham Rivera from Florida Pain Relief Group joins us to discuss how they can help you become a weekend warrior once again. Good morning.
Good morning.
I think we all live this, right? We're in Tampa. We're in the Bay Area. There's no better place to be a weekend warrior with everything to do here. But yeah, sometimes that pain gets in the way, does it not?
Sure does, sure does. Especially when we try to do too much at a time. Try to play those 18 holes when we're only used to play 12. Our buddies come over, we're trying to show off. There you have it, you know.
So let's talk about, well, and let's start with golf then. That's what we were talking about, kind of golf shoulder, which, by the way, these symptoms can kind of, you don't have to be playing just golf to kind of experience this pain, correct?
Correct. In fact, the most common one is probably tennis elbow.
Yeah.
I see a lot of times in carpenters, meat cutters, people have never
And then you tell them,
played
you think you have tennis elbow. They go, what?
Yes, we see it all the time. It has nothing to do with it. It's a repetitive motion of something that they're doing. And of course, they're overusing the tendon, the group of muscles involved, and the whole thing gets swelling and painful.
So is there treatment for that? Can you reverse that? What do you do?
The best thing to do is not to get there in the first place, right? Common sense. But once it gets there, of course, there's medications we can use, topical agents we can use, ultrasound, physical therapy, massage. We have a whole lot of modalities. The interesting part about it is when it's left untreated, it becomes really a chronic problem. And then that's when it becomes difficult.
Well, how do you know when to get treated? I mean, how do you know what's normal or what should be? Okay, this is kind of just hurting me for a couple days, it gets better, you go on, you know, it's just something that goes on and off. How do you know when? Exactly
that, when it's more than a couple days.
Okay.
You know, you would expect most of these injuries to resolve by themselves in a few days, but no, it doesn't. When it doesn't, that's when you need to come and see us, because it's probably not going to get any better.
We've talked about age before. What's the typical age when you start seeing people with golf shoulder and tennis elbow?
You know, the typical patient in my office is 50 and above.
Okay.
And those are the people that you're going to see them. You see it every now and then in people in their 40s that beat the daylights out of their shoulder, out of their joints when they were little. But no, typically it's the men in their 50s.
All right, so when they come in, if someone's watching this morning and going, uh-oh, I think this is me, I think I need to come in and see this doctor, what do you do from there? What do you try to figure out what's the best treatment option for them? Yeah. What can you provide?
Yeah, I tell you, the key here is to sit down with the patients and try to learn about them. There was a French guy who once said, physicians prescribe drugs of which they know very little for diseases they know less to people of which they know nothing. And that's exactly what we try to do. We know the drugs very well. We know the diseases reasonably well. We have to spend our time in meeting our patients and knowing about people. Once you find out what is it that they're doing, you'll be surprised. It actually becomes quite easy. Figure it out and solve it.
Well, and as we kind of wrap up here, you know, as again, we have a very active lifestyle here in the Bay Area. We have a lot of weekend warriors who want to continue that. So what's your take home? What do you tell people?
Keep it up. Go for it. Keep it doing it. You know, when it hurts, come and see me.
All right. Well, thank you so much for being here. We love having your team on the show, and we look forward to having you back, Doctor. Thank you so much.
My pleasure.
And again, for more information on how Florida Pain Relief Group can help you enjoy your favorite weekend sports again, you can call 844-KICK-PAIN or log on to floridapainreliefgroup.com.